Hey guys, I'm Sarah Lavonne and welcome back to my YouTube channel. One of the most annoying pregnancy and postpartum symptoms is hemorrhoids. There is no shame in that game. They are actually super normal, but sometimes uncomfortable to talk about. And let's be honest, they're actually just uncomfortable in general and actually can be pretty painful for you. So I'm here today to talk all about hemorrhoids and especially how to help them feel better because I know that's what you all want to know. So make sure you subscribe down below and then let's get started. If you haven't heard about hemorrhoids before, today is the big day where we are gonna talk all about what is hemorrhoids, how to fix them, why they happen, and then hopefully help you to be set up to feel a little bit better because hemorrhoids can be such an annoying symptom. First and foremost, what are hemorrhoids, okay? So while I was planning for this video, I was trying to find like a model and like literally Googled like butthole model, but it didn't go so well as you can imagine. And so I was trying to figure out how I show you a butthole without showing you a butthole. Oh, this is gonna be a good one. Okay, sorry, Brian. Okay. So what is a hemorrhoid? A hemorrhoid is basically when you have some of the inside of the rectum, the tissue in there, that if you imagine this is the booty hole or the butthole and some of that tissue bulges out of the butthole. Now, the normal first sign of a hemorrhoid is pain on your butthole, okay, or your anus. So if you're wiping or you're going to the bathroom and it feels like somebody's like stabbing you in your butthole, you might have a hemorrhoid, all right? The other thing that's really common with hemorrhoids is rectal bleeding. And this is important to distinguish for pregnancy because we wanna know, is it coming from your butthole or is it coming from your vagina? If it's coming from your vagina, it might be labor. If you're less than 37 weeks, vaginal bleeding is not normal. You can go to my warning signs of pregnancy video for that. But if you know it's coming from the rectum or from the anus, we wanna know, and hopefully it's fresh blood, not old blood, so it would be like actual bleeding. First of all, we're not freaking out, but we wanna identify it's from the anus or the butthole, and then is there pain? And it is true that you can actually have a hemorrhoid and have a little bit of rectal bleeding, but it's actually no pain because hemorrhoids, typically the ones that people complain about are gonna be on the outside of the anus, but they can actually also be on the inside where there's like a little bubble in there that as the stool passes, it kind of breaks down the tissue and like breaks open a little wound, and then you might see some bleeding as well after you go to the bathroom, okay? The other super common sign of a hemorrhoid is itching. And so that's usually after you've had some pain, it's been really painful to poop, and then maybe it starts to get better, but then afterwards you're like, oh my gosh, and that's really healing tissue most of the time, but you can be like, oh my gosh, I like have to itch off my booty hole. The other thing is you might actually reach down there or take a mirror and look at your butthole, and instead of it looking like a tight little round whatever, that you actually see a little bubble. And you might feel that if you reach your finger down there. Make sure your hands are clean, and you can do that. It's your body, and I actually encourage you to explore your body and maybe take a look, especially if you're having symptoms, but you might see like a really big bulge around the anus. And so that technically is a hemorrhoid. It is totally benign. We are not freaking out about it. We're not calling 911 and getting an ambulance and running to the hospital, okay? It's not that big of a deal. More than anything, it's just more of a nuisance, and they really can be that you have multiple or they're really large and you have a hard time sitting. It affects your life, and the pain can be really intense, all right? And so I want you to know that this is a normal symptom of pregnancy and postpartum. So let's talk pregnancy. Pregnancy, there is a whole baby sitting in there that's putting pressure on the rectum. And as you can imagine, as the baby comes down and puts pressure, it can push some of that tissue out your butthole, okay? So that's normal, annoying, but normal. Now in postpartum, most of the time you might have some hemorrhoids in pregnancy, and if you do, I would anticipate them not getting better until after you've had the baby, because even if there's that tissue inside, you go to push your baby out, and all of a sudden while you're pushing, sometimes some hemorrhoids can pop up from pushing because you imagine you have so much pressure down there, okay? So we know it's normal. It's not the end of the world. It's not a reason to call 911, but it can be really annoying. The other kind of side symptoms that could come with hemorrhoids would be some leaking of feces. So leaking of your stool, where you actually find like maybe some skid marks in your underwear, or that you have like you've cleaned off and there's there's still like poop in my underwear. Like, what the heck? I didn't poop my pants, but like there's still poop in there. And that's because if you imagine there's this little bubble and there's all these ridges on your anus that when you wipe, that like sometimes it's just like poop and stuff can get stuck in there somewhere. Okay, that's where like a little Tushy, Mr. Tushy, I got like a little bidet thing. I'm loving that. Not that I've had issues with like pooping my pants or having skid marks in my underwear, but I'm just saying it's like real extra clean. I'll link it down below. So if you're having trouble with like some residue in your underwear or something, then there might be some hemorrhoids down there. Now, are we freaking out about it? No, honestly, if you don't have signs and symptoms or you're not having pain that's really affecting your life where you're like, oh my gosh, I have to do something about this, then we let it be. Once you have hemorrhoids, you are prone to continuing to have them throughout your life. There are people that have the little bulge bubble on their butthole that causes them no issues, no pain. It just is what it is, and they live their life, okay? I don't want you stressing about this. When we care is when it's actually causing you pain and discomfort. So this may come especially in the postpartum period after pushing your baby out, or even sometimes just from the weight of the pregnancy of the baby coming down. Even with C-sections, you can have some hemorrhoids, and so we want to know what we can do about it, right? I hope that makes sense. So there are some things that you can do. So let's talk about what's happening down there. First of all, what do we know about healing? So you imagine we're treating it like a wound or like some sort of painful something or other, okay? So what do we do for pain? Medications is one, and I'll show you / talk about some medications. The other thing is ice or hot. So I have 2 warm and cold options for you that can help soothe. Most of the things that we're doing is helping to relieve the symptoms, meaning the pain, so that we can give your body a chance to heal itself. Now, one of the most horrible things when you have a hemorrhoid is sitting on your butt. So I would say sitting on a soft surface. Also, you can roll up. Like if you were to take a towel and roll it up into more of like a circular shape, this is like the worst demonstration. I should have brought a towel, but I'm not gonna do it. So that there is some sort of like hole. You can also buy a donut. I'll link a bunch of this stuff down below. You can buy a donut pillow where you basically sit, and there's actually specifically for hemorrhoids where you sit it down where the pressure on your butt doesn't sit on the actual butthole, so that like basically the butthole dangles in the air, and then the rest of your weight is being sat on your hips rather than on the anus portion, okay? So that's one thing that you can do. The other thing is obviously listening to your body and changing positions and sitting and laying in ways that make it feel better. If you're pregnant, that also includes relieving the pressure of the baby. So that inversion, I talk about this in my How to Engage Your Baby video. That inversion would be really good for you to do for 3 big breaths, and that may help to bring some of that weight off of the rectum. It may not fix the hemorrhoids, but it may provide some relief. And then we want to really avoid straining. So straining, this goes for prevention. And actually with everything I read online, I was all over Up to Date last night looking up all sorts of hemorrhoid treatment modalities and what everyone recommends. And the biggest thing people talk about is prevention. Now, you're pregnant, so you can't totally prevent it. But one of the ways that it happens is imagine you put enough pressure behind, like there could be tissue in there and the baby's coming down and really putting pressure and nothing happens. And then you actually go to poop and you add some like, oh, I'm really straining, and all of a sudden that hemorrhoid pops out, okay? So we want to avoid straining while you go to the bathroom. Now, pregnancy puts you at risk for constipation, which adds to the risk of hemorrhoids, right? If you're constipated, you're straining more, and that can cause more hemorrhoids. So we wanna set you up to have a normal, nice, soft bowel movement when you go to the bathroom to avoid straining. One of my favorite devices is called a Squatty Potty, and I have one, and it's like changed my bathroom life routine as far as pooping goes, but it actually realigns your rectum so that you don't have to strain as much. That's one of my #1 recommendations. When you get pregnant, get yourself a Squatty Potty. I will link it down below, and that just aligns your body so that you don't have to strain so much, and the stool just kind of falls out a lot easier. So no straining. And then we want to add fiber to your diet. So if you're struggling with constipation, we really want to be on top of this so that you don't end up with hemorrhoids. Again, because once you have them, you may struggle with that for a while / / the rest of your life potentially. And so we want to avoid straining. And how do you do that? You have to have enough fiber in your diet to make sure that your poop is soft. Now, fiber in combination with fluids. So this is where staying hydrated, there has to be enough water that you're intaking in your body, because your body's gonna be like, I need that water to survive. So it's gonna pull from your intestines, your digestive tract. And by the time the stool gets to the end, if you're somewhat dehydrated, the body's gonna have pulled like as much fluid from the stool, making your poop really firm and hard. So we wanna stay extra hydrated, and then we also want a high fiber diet. What does that mean? That means a lot of fruits and vegetables. Papaya is super good if you're constipated. Prunes, prune juice, any kind of dried fruit, lots of greens, all of that are gonna be high fiber foods. One of my favorites is flaxseed. So I'll add flax to my smoothies, or you can mix it in your oatmeal, you can throw it in your cookies, just starting to get in the habit of adding some of that just to make sure you're bulking up your fiber intake. Now, there are fiber supplements, but anything you're gonna take, and I do have some products to show you here. I did like a late night CVS run, and the guy behind the counter was like, oh, this woman's seriously struggling with some hemorrhoid issues, which I'm not currently. And so instead of product, you wanna make sure that you're doing all the things that don't include taking medications or using products. And then when I make any recommendations, make sure that you're checking in with your provider, because we don't want you taking anything that's contraindicated for you. But in general, these should be in theory safe for pregnancy, all right? So there are fiber supplements like a Metamucil or a Miralax, or a Miralax not so much, but or milk of magnesia is another one that is mostly safe for pregnancy. Again, check with your provider, but if you're really struggling, adding some sort of fiber supplement to your diet is gonna be really helpful. The other one, where'd it go? Hold on. The other thing that you can take is called Colace, or Docusate, okay? Docusate is the generic name. So with medications, you always have a generic name and then there's a brand name. And Colace is just the brand name for one particular company that's done a very good job at getting themselves into the market and being like the stool softener. But if you're looking for the same thing, it's literally the same thing. This is a CVS brand. It's called stool softener, called Docusate. And typically you're taking around 200 milligrams, but again, check in with your provider, and you're taking that twice a day. Now, I wanna be very clear, there's a difference between a Colace or a stool softener and then a laxative, because we do wanna avoid giving laxatives as much as we can. It causes dehydration, it can cause more issues and discomfort, and especially in pregnancy, we're like especially worried about that. And so a stool softener is a little bit more preventative. Honestly, if you've had a C-section or you're taking any kind of higher pain medication, you need to be taking this. This is just like a total bonus. On a side note, to avoid constipation and therefore hemorrhoids, twice a day to make sure your stool is soft. And so what that does is it's just gonna pull some extra fluid into the stool so that your stool is a lot softer and easier to pass. That's what that's for. This is not a laxative, but if you're gonna take something, it technically is safe for pregnancy and postpartum. Again, check with your provider. But if you want a supplement or you're truly needing help, a Colace would be my recommendation for you. It's just over the counter. You can get it at any drugstore. So we want to keep the stool soft, make sure you're hydrated, and make sure you're aligned when you're pooping so that you're not straining. Now, let's say that oopsies, like, we have this hemorrhoid. Now, there's no shame in that game either. This is something that, like, I think when we talk about our buttholes, like, people feel uncomfortable about it. No reason for that. We're here to talk all about your booty holes and your vagina holes and your nipples and all the uncomfortable things that are totally not uncomfortable for me to talk about. And so when we talk about that, I want you to be very clear as well that it's not your fault, that there's nothing that you did to cause yourself to be in pain. It just happens, and if it happens, we'll manage, okay? So let's say you have a hemorrhoid. What are some things you can do to make you feel better? That first poop after you have a baby can also be very uncomfortable. And so as you anticipate going to the bathroom, or if you anticipate knowing that you have a hemorrhoid, that can be really stressful for you. So one of my other recommendations is some sort of lidocaine spray. Now, there's also something called Dermaplast, which is a benzocaine spray, and it has more of a cooling effect. I couldn't find that at CVS yesterday, but any kind of lidocaine spray that makes sure it's like you can spray it on open wounds and it doesn't have alcohol in it. I saw some with alcohol yesterday and I was like, ooh, Like that's not good for the booty hole. And so some sort of numbing spray. And that's what this is, that before you go to the bathroom, you would take it off and then you would like get in there and spray on the butt, wait a second, and then go to the bathroom. This is also really great for postpartum healing, honestly, for your vagina if you have an uncomfortable vagina. Nice to just have around the house. Dermaplast is usually my first go-to, but a lidocaine spray, same diff, and that will help you to be able to go to the bathroom and it maybe not be quite as painful for you. Now, once you go to the bathroom, you want to clean off really well, and that's where I have a Tushy. I just got it from Amazon, and honestly, like I'm obsessed. I mentioned this before, but it's basically a bidet. So all of you that have bidets as a part of your daily life in the United States, we don't have bidets. I was like, where's this thing going? And it like shot on the wall and it got all over me as I was setting it up, and I was very nervous about using it. But honestly, it's so nice because it's just a gentle way to clean yourself off after you go to the bathroom rather than really wiping aggressively and getting all up in there, especially if there's any feces left over. And so a bidet would also be something. I'll add it to my Amazon list. I'll link it down below, the one that I got, because I like actually think it's added to my life well-being, and honestly it's better for the environment and saves you on toilet paper. So there you go. So that's nice too. So you want to avoid aggressively wiping yourself, and then there's some products that we can put on the actual area to help soothe it or treat it. That first one would be some sort of Tux pads. And so I did get the CVS brand. Honestly, I'm not a huge like spend more money than you need to spend person. And so you can get like Tux. That's the one that they've done a really good job at marketing, but this is just CVS brand or a Target brand or whatever. It's the same thing, just look at the ingredients. And in this is gonna be witch hazel pads. So there's just 50% witch hazel in this. You're gonna open it up. In here are these witch hazel pads. So they're already wet with the witch hazel, and the witch hazel is really gonna help with the inflammation because that's a part of the issue, that it's really inflamed down there and irritated. So it's gonna soothe the area. You can shove that up next against the booty hole, and that will help. And like, mind you, not in the booty hole. So like if your butthole's here, just put it on there and then bring your underwear up, or you can wear your pad if you're postpartum. You can put this on your pad or like shove it in your butt crack and then put your pad on top so that it's soothing that. Now, I also think that like because they're wet, the longer they sit there, like if this is sitting there for 4 hours, it's not doing the same amount of work. So maybe leave it in for a while, and then when you get up after, it doesn't matter how much time, but just not sitting so it's soaking your butthole. Otherwise it may get a little pruny in there. So that's my little tip for that. But this can sit there. Honestly, if you forget about it, don't stress about it. It's gonna sit on your butthole, soothe your booty hole with some witch hazel. Now the other option would be, I found these are by Preparation H, and Preparation H is like the hemorrhoid company for the United States. If you're in the United States, now mind you, the idea with this is that it has witch hazel and lidocaine. Now this one also has phenylephrine, which is like an anti-inflammatory, which is kind of pretty awesome. They're flushable, and so this would be a wipe for you, and they're individually wrapped so that you take one, they're on the go, which is really nice, and there was other ones that are on the go as well. And then after you wipe, you would wipe yourself with this wipe that has the numbing on it, that can help with the soothing, cleaning you off, getting you really clean down there, and then helping with the anti-inflammatory properties. So I thought these were really cool. They are more expensive, but I thought that was a good idea. The other thing with the Tux pads, and I say Tux only because, again, good branding, but the witch hazel pads, there are witch hazel pads that also have aloe and lidocaine in them. I couldn't find them at CVS yesterday, but there are options for you, all of which is totally fine. They may be very soothing for you. Some people are sensitive to witch hazel, so you can try it out and see. These are also really great for your vagina too. So you can throw one on your booty hole, throw one on your vagina, and just soothe the little area down there and help it be not so inflamed and uncomfortable. So Tux pads / witch hazel are the first option. And then there's the classic Preparation H, all right? So this is a cortisone cream. Really, it's a steroid cream. I got Preparation H again because it's like known to be the one for hemorrhoids. I also like that I've actually never bought Preparation H before until today, but I like that it has the little tip on it so that you can actually like get all up in and around and squeeze that little anus with all the juices. So what you would do is you go to the bathroom, clean yourself off, maybe with a wipe. You'd maybe use your bidet, dab, not rub, because that's just gonna irritate the area. throw some Preparation H on top so that you're kind of rubbing it in and around the area. And this is gonna really help to soothe the area. Honestly, these creams, they work very well. And for most people, they are enough to soothe a hemorrhoid. And then slap this guy on your butthole and you should be good to go. A lot of times too that people just need to be patient. So that's the other thing I would encourage you, that if you have one, we wanna set you up for not straining. We wanna soothe it so that it can heal. Also, oxygen heals. And so anytime that like you can not wear underwear or kind of like air out your butt, avoiding sitting and putting extra pressure on your butt, changing positions if you're pregnant so there isn't so much pressure on your butt. And then occasionally the other amazing option I have for you is what we call a Sitz Bath. And this is great for healing your vagina too. I think I talk about this in my Healing Your Vagina video. I don't actually remember because that was a minute ago, but I have my like massive bag of Epsom salts here. And so Epsom salts, clearly I keep around the house, are great just for stress relief if you're having leg cramps. If you just need to be calmed and take like a nice bath, they're great to throw in your bath. That's why I have them. But when you're looking for Epsom salts, you definitely want them to be fragrance free and literally just salt. So this one I got from Amazon, and actually people are like, that's such a big bag, but actually you're doing around 2 cups for a bathtub, like a normal size bathtub. If you have a bigger bathtub, throw an extra cup in there, but you need a good amount in order to help to soothe the booty hole and the vagina. So this is actually great for healing postpartum vagina as well. You can throw some essential oils in there. I'm not gonna get into that. If you want a whole one on Sitz Baths and options for that, I can do a whole YouTube video on that. Let me know in the comment box down below, okay? So occasionally, I would say even once a day, you can do what's called a Sitz Bath. And what that means is there's actually devices you can buy. I almost purchased one as well, but then I was like, I don't wanna have this thing around me in my house. And again, if you want that dedicated video, I will get one and I will show you all the things about a Sitz Bath. But the idea is it sits on your toilet, you put some water in it, you put some salts and goodies in it, and then, but it's warm, and then you just sit yourself down so that your butt is sitting, and your vagina is sitting in that nice Epsom salty, soothing, healing, watery fluid, which is good for you. And that's gonna bring extra circulation to the area. With the heat and circulation equals cells that help to heal the area. So I would suggest daily even you can do like twice a day Sitz Baths, where basically you're sitting in warm water and just letting the butthole soak on that warm water with some Epsom salts. That could be in a Sitz Bath that you buy. You may also be able to get one from your hospital and then take it home, or even just a bathtub where you're just sitting in some warm water. And then you basically just wait and see. So let it heal, give it the time. Honestly, if you're at the end of your pregnancy, I usually tell my clients to just manage the symptoms until you have your baby, and then get really on top of the regimen and expect it to get better. But it may not get better until you have your baby and you push your baby out. And you may actually struggle with this off and on for a while. Kind of like, it's like you're more prone to having them once you have one. It's like you have that little bubble that like pops in and out a lot, which is fine. And most of the time, guys, these are not causing pain. As long as you're not profusely bleeding from your butthole, obviously that would be abnormal. That would mean call your doctor / go to the hospital. But if you have some random bleeding down there and it's not coming from your vagina or some pain, we're gonna manage the symptoms. Now, let's say you do all those things, and I would say do those for at least 48 hours and see if your symptoms get better after 24 to 48 hours. If they're not improving at all, in fact, they're getting worse and worse and worse, and you're bleeding a lot more, you can't sleep, you can't do your normal daily stuff, call your doctor, okay? Because there are prescription creams that they can prescribe to you that are stronger and gonna be pretty effective. I usually, like after 24 to 48 hours of people struggling, I'm like, just call your doctor, get a prescription for it's called Anusol, this type of prescription hemorrhoid cream that can be really effective to help with your hemorrhoids. Worst case scenario, there is like a hemorrhoidectomy, like if they're really big and really awful, where they actually would do a procedure, and like it's technically like a little minor procedure or surgical procedure to help get rid of them. But we really want to avoid any kind of making any kind of cuts or incisions or any of that down there, because it's so prone to infection, especially towards the end of your pregnancy. We don't want to mess with anything down there leading up to the birth of your baby, okay? So if we can avoid that, we definitely want to avoid that. Do all the things, give it some time, be super patient, and then obviously call your doctor if it keeps getting worse and worse. And then ultimately there are other things they can do. If it's not improving, you're gonna wanna stay in close communication with your provider, and then they may be able to give you some alternative options to help you to really live your best life down there. Thank you guys so much for being with me here today. If you want more from me, the normal spiel, you can head on over to bundlebirth.com. Everything will be linked in the description box down below, so make sure you check that out because I got lots of other extras down there. I have online childbirth classes. I offer virtual support, coping with labor class. Make sure that you feel nice and confident and ready for your upcoming labor and birth. Make sure you subscribe down below, give it a like, and then turn on the little notification bell so that you get notified when I post a future video, because there's some fun stuff coming at ya real soon. If you are struggling with a hemorrhoid or you have been there, let's all support each other. I think a lot of times this stuff is like so uncomfortable to talk about and people are so ashamed. They're like, oh, I have a hemorrhoid, or I'll get these DMs on Instagram or something. And honestly, guys, this is so normal. This is our body. As my sister said in her birth, a body's a body and you can't control it. So no shame in any of this. Let's talk about it. Let's figure out and share down below maybe some things that worked for you to feel better so that none of us feel alone, because everything is harder when we feel alone. Until next time, don't forget to flex and flow, and I will see you soon. Bye. No. Okay. Out the side of your butthole. Just imagine my mouth is a butthole. That's not a good image. Become like where you want to like itch your butt off, not your butt, like your actual butthole off. I need to be very specific because like your butt versus your anus. Wow. Okay. We tangent. Okay. I gotta start over. This is intense. Okay. And these are it kind of helps with the inflammation. The anti-hemorrhage. Why do I keep saying hemorrhage? What am I doing with my life? I don't know what we're gonna be able to do.